Now, today we celebrate love, but a leading healthcare organization says some consequences of love are far from being romantic. Right to Care is calling on South Africans to use condoms to reduce the risk of getting HIV and sexually transmitted infections. This says the country marks STI and Condom Awareness Week. To speak more on this, we're joined by Right to Care's Precious Robinson. Precious, good afternoon and thank you very much for your time. I'd say it's quite fitting that on Valentine's Day we actually discuss safety, because some might be going on their first dates today, which could pose some sort of a risk, and as we say, around STIs or any other sexually transmitted diseases. Now, talk to us about Right to Care's plea to citizens this Valentine's Day.
Thank you very much, and good afternoon to you, and good afternoon to our viewers at home, and happy Valentines to those that are celebrating Valentines today. And those that are not celebrating, we know you are there, we love you, and there's much more to come other than a Valentine's Day. Well, Right to Care as an organization that is treating health seriously, that is supporting the National Department of Health in making sure that the lives of South Africans are improved, is joining hands with the National Department of Health in this February month, which is a month that is a month of sexual reproductive health. We are looking at Pregnancy Week, STI Week, Condom Week, actually the whole package of sexual reproductive health. And within this, we are looking at Condom Week. And today being Valentine's Day, we as Right to Care want to call upon our young ones and lovely ones, our males and females out there, that let's celebrate Valentine's Day responsibly. You love, but you also want to live long. You love, and you also want a healthy life. So we are saying, as we are going to celebrate and enjoy ourselves today, remember to prevent the sexually transmitted infections, HIV, and other sexually transmitted infections included.
No, most certainly. But then talk to us a bit more about STI and Condom Awareness Week. What are some of the programs that you'll be embarking upon?
So, Right to Care, like I said earlier on, is working with the National Department of Health. So, as we all know that on the health calendar, this is the Condom Week. As an organization, we are pushing the agenda of prevention. We are promoting now the use of condom. We are encouraging our young girls and adolescents to be resilient and vigilant. We are saying to them, even if you want to feel love, you want to celebrate, make sure that you don't fall into the trap of having unprotected sex. If you are already engaging in sexual activities, can you please visit a healthcare facility where you can be screened for any STI? If ever you are found to be having one, a syndromic approach will be used to sort of manage to treat those infections to avoid you having some complications later in life. We also are promoting medical male circumcision, which we are all aware that it has proven to be reducing the risk of STIs, HIV specifically. And then we have seen how South Africa has made gains in reducing new infections in males using the male medical circumcision. We are also promoting, supporting the promotion of HPV vaccination, COVID-19 vaccination, because all of those are actually preventing infections that can be preventable.
And then accessibility, condom accessibility remains some sort of a talking point. Are you satisfied that particularly with young people, they are accessible? Because at times you find they're at clinics and young people are not necessarily very comfortable to go there. So are you satisfied with them being accessible to young people?
We are not yet satisfied. Yes, they are made available, but we don't think they are meeting the 4 A's, which is accessible, acceptable, available, and affordable. And for me, for the youth, you need to give them the condoms that they want to use at any given time that they want to access them. They need to be everywhere. And the biggest challenge is that we are not able to monitor when these condoms are actually running out. we are not actually able to monitor whether the service providers or the outlets that are supposed to be providing condoms outside healthcare facilities, being your clinics and whatnot, are actually having them. I would be very much happy if these condoms are everywhere, in supermarkets, not being sold, but free for everyone's access, at areas where people are going, like in Shebins and where, everywhere where the youth are. We know that some of them preferred this branded condoms and whatnot, and I think this is high time. I know during the time of Minister Mzwaledi, steps have been taken to improve the quality and the brand of these condoms, but it's still not enough, because even if they are there, some of them are still going over the counter to try and access condoms. Not just that, after they've accessed them, how do they use them? Do we still have a situation in the facilities where we have a youth corner or a period where we give people health education on still using the condom, the benefits and how to use, how to dispose, and all those things. And then the risk of taking alcohol, using drugs, as opposed to being able to think properly and say, oh, I have a condom in my bag, oh, I have a condom in my pocket. We still need those access issues to be sorted out as society. It shouldn't be just the work of the Department of Health. Implementing partners, donors, funders, and society at large must make it their responsibility to ensure that the use of condom is promoted. We make it a norm, because it's not just about HIV. You've got STIs, you've got pregnancies, you've got a lot of other issues that we can save with the use of condom. Mm-hmm. Unplanned pregnancies, unnecessary abortions, which end up leading our young girls to complications. Others even die. The pelvic inflammatory diseases that lead to infertility later on in life, your cancers that can be prevented when you vaccinate, but then if you didn't get the HPV vaccine, can you not use the condom because it sort of support as a barrier method?